Yesterday, we saw people heading out for brunch, some shop therapy and a pints at the pub, enjoying their newfound freedoms. You'd struggle to see a vacant seat at a restaurant or an empty shop. We know there were lengthy queues outside retailers and at shopping centres like Chadstone, some quite big crowds. Foot traffic was up to 80% of the usual average in some streets, a remarkable increase when you consider just a few weeks ago those same streets were effectively empty. Now, all of this is welcomed by punters bored in lockdown and also by businesses who now have money running through the till for the first time in months, but they do want more. And the Australian Hotels Association is calling for the Premier to meet the hospitality industry halfway and on November 9 announce a maximum capacity of 40 people indoors regardless of the spaces they're spread out in. Of course, on that date, it would move to 40 people indoors, but with a maximum of 20 people per space. Meanwhile, the man in charge of America's response to the COVID-19 pandemic, Dr Anthony Fauci, has praised Australia for its handling of the situation, and in particular Melbourne for its mask mandate. Dr Fauci, I should say, has said that he wishes similar measures were used in the United States, and really over there, masks are now seen as a political statement rather than a health measure. He did concede that it is easier for Australia to control pandemics as a result of it being effectively a big island nation. Take a look.
Australia's done well. New Zealand has done well. Some of the Asian countries have done well. If you look, I mean, I would like to say the same for the United States, but the numbers speak for themselves. Geographically and otherwise, the ability to contain within one's country, when you have a country like Australia, which is a gigantic island, it's easier to contain in and out. Whereas in the United States, that's not the case.